guys, it's Leah B here from Prestige Veteran Medical Consulting. I am a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So did you guys know that veterans with congestive heart failure, or CHF, may qualify for veterans disability benefits? So CHF is not just heart trouble. It's a serious chronic condition that can impact your energy, daily activities, and even your life expectancy. So in today's video, I want to explain what CHF is, how VA rates it, and what the medical research says about the causes and risks, and how secondary service connections may apply, and resources available for veterans. So let's just jump right into what CHF is. So congestive heart failure happens when the heart can't pump blood effectively enough to meet the body's needs or the demands of the body. So this doesn't mean that the heart has stopped, but it's weaker or stiffer than normal. So symptoms can include shortness of breath with activity or even at rest, swelling in the legs, ankles, and feet, fatigue and weakness, difficulty exercising or performing daily activities. So that makes sense, right? If the heart is having a really hard time with the demand of the body, you're going to have difficulty just walking, maybe even. Sudden weight gain from fluid retention. So for veterans, CHF can mean daily limitations like trouble walking, standing, or even sleeping without difficulty. It's a progressive condition that requires ongoing treatment and monitoring. So let's talk about some of that literature review and what the research says. So heart disease is one of the leading health issues among veterans. So research published in the Journal of the American Heart Association shows that veterans have higher rates of hypertension, diabetes, and obesity, all major risk factors for CHF. A 2021 study in Circulation Heart Failure also found that veterans with PTSD are significantly more likely to develop cardiovascular disease due to things like chronic stress and inflammation. So exposures also matter. Agent Orange, burn pits, other toxic exposures have been linked to heart problems, and in some cases are presumptively recognized by VA. So all of this shows that CHF in veterans isn't just about age. It's often connected to the unique risks of military service. So let's talk about VA disability and CHF. So how does VA rate congestive heart failure? So CHF is rated under the cardiovascular system, and the ratings are based on severity and heart function, usually measured by tests like METs or metabolic equivalence or ejection fraction. So here's the breakdown. So at 100%, you're going to have chronic congestive heart failure or left ventricular ejection fraction that's less than 30%, or symptoms at 3 METs or less, meaning severe limits, like being short of breath after light activity or dressing yourself. The 60% rating level is more than one episode of acute CHF in the past year, or symptoms at 3 to 5 METs, or left ventricular ejection fraction is going to be between 30 and 50%. The 30% rating is symptoms at 5 to 7 METs, such as, you're having symptoms walking briskly or climbing one flight of stairs, or evidence of heart enlargement. So the 10% rating is going to be symptoms at 7 to 10 METs, such as maybe some shortness of breath with jogging or heavy lifting, or continuous medications are required. So the higher your limitations, the higher your rating is going to be, right? So the worse your function is, the higher that rating is going to be. And that makes sense, right? If you're barely having any symptoms at all, you might only get that 10% rating. And if you're barely able to do anything, you might be at that 100%. So let's talk about some secondary service connections. So CHF can be connected to or worsened by other service-related conditions. Common links include things like hypertension. So if you're already have a presumptive condition, for many veterans have hypertension related to Agent Orange, for example, and hypertension can then lead to congestive heart failure in some cases. Things like diabetes, type 2 diabetes, which can also be tied to Agent Orange and be a risk factor for heart disease. Veterans with PTSD and chronic stress. The research shows that it increases risk of heart disease, sleep apnea, which can contribute to high blood pressure and also can contribute to heart strain. Ischemic heart disease often precedes congestive heart failure. On the other hand, CHF itself can cause other secondary conditions as well. So CHF can cause chronic kidney disease, due to some fluid overload issues, depression and anxiety from chronic illness, reduced mobility, and musculoskeletal deconditioning. So we see this a lot, that obesity as an intermediate step. So oftentimes it can be, causal, or it can cause CHF if you've got obesity and you're, it's putting extra strain on your heart. Also, if you've got CHF, maybe you become obese because you're not able to do as many physical activities as you used to, and then it can lead to other conditions. So these secondary conditions and connections are important to consider when you're looking at VA disability. So what are some challenges for veterans with CHF? So living with congestive heart failure creates unique challenges for many veterans. So veterans find themselves unable to do physical activities that they once enjoyed, even routine tasks like shopping, walking, yard work, things like that can cause exhaustion. Frequent hospitalizations and medication side effects can disrupt daily life. And because CHF is progressive, veterans often worry about their long-term independence and their life expectancy. So the mental and emotional toll is just as real as the physical toll. So what are some considerations for those veterans that are filing for CHF? So if you're filing for CHF, there's some really great instructions on va.gov that you can DIY. You can also work with a veteran service organization. So usually you're going to want to make sure you have a medical diagnosis. It's generally going to be confirmed by an echocardiogram or other tests like stress tests. Service connection is a consideration. How did your service cause it or worsen it? Or another service-connected condition, how did that cause it or worsen it? VA may send you out to an exam if they believe there's enough information here to order an exam to get a medical opinion. So you'll see a CMP examiner, and they're going to go over your history with you and give an opinion on that the adjudicators are going to use as part of their investigation into whether or not you should meet criteria for service connection. So many veterans will include medical evidence like test results, like their MET scores or their left ventricular ejection fraction from their echo, hospitalizations, and treatment records. They document secondary conditions like kidney issues or depression or sleep apnea. So that medical documentation can really help support your claim in some cases. So what are some resources for veterans? So if you're a veteran with congestive heart failure, there are resources like VA cardiology clinics for diagnosis, medications, and ongoing care. Your primary care manager is also a great resource. So veteran service organizations like DAV, VFW, American Legion can help you with your claims if they've got VSOs there. American Heart Association for patient education and support. So the Veterans Crisis Line at 988, you can press 1 if you're struggling with emotional weight of living with CHF. So congestive heart failure is a life-changing condition, but veterans should know that VA does recognize this for disability benefits. And if your CHF is linked to service, whether directly or through conditions like hypertension, diabetes, your Agent Orange exposure, etc., you may qualify for significant compensation. So if this video was helpful, please hit like, subscribe, and share it with another veteran who might need this information. And as always, thank you for watching, and please drop some comments, and I'll see you guys next time. All right.